Phadke, Madam said that about visual feedback and the proprioceptive feedback. So now in our field there are a lot many. So I had a lot of athletes that I see coming up with ankle sprains and anterior cruciate ligament reconstructions. And whenever we try to give them the balancing exercises with the vision open, they are pretty good with it. And when we occlude the vision, they are very bad with it. So now it is a proprioceptive exercise. This is a new boom that is coming up in the physical therapy also. That we call it as a proactive responses and the reactive responses. So when we occlude the vision and we give a proprioceptive feedback to the individual, we are stimulating their proactive responses. So suppose I am training a football player, okay, and he is anticipating that the ball is going to come in that direction. So he anticipates that position by the proprioceptors because of the training which we have given him, and anticipating how the ball is coming, he can avoid the injuries. So that is how the proactive reaction works. And after learning that, it also acts as a reactive response. So now he knows that by doing these mechanisms or by adopting these body positions, now he understands, now I will not land up with multiple injuries or the repetition of that particular injury. So the proprioceptive rehabilitation is a coming up boom which we use in a lot of ligament reconstructions and the muscular tear where the repair happens. And it is a coming up boom that is there in the physical therapy.
I think you should train us on
Yes.
Yes, that we call it as a centering, because I use that in whenever I teach the archery people, they have that particular stance. And they
you
have
an exercise plan now, right?
Yes, but that I will take it tomorrow. I had planned that tomorrow.
Oh.
I will be assessing you all today.
So you have the assessment plan.
Yes.
I just would like to add, like as Sir said, Madam mentioned, like visual cortex is very dominant, and that is one of the reasons why listening is so difficult.
Yeah.
Mm-hmm.
So the block in the listening is because our visual cortex keep like processing the information in the background rather than focusing on the sound.
So auditory training also will be a part now after some days.
Get a lot of ladies who are not able to conceive and the ones who are working very hard in the corporate jobs and all of that. So there was this lady, I was asking her that she was going for IVF, she was just 31 years of age. So I said, have you tried natural pregnancy? So she said, no. So I said, why not? So she says, no, you see, my husband stays very away from me and he comes just for 15 days and then he goes again. So there is a question of trying for 15 days. So when we were young, we were taught, I don't know about the rest of you, I actually read a book, In that book it was written that the phases of the moon and the tide of the ocean affects your mood.
Yes.
You feel sexy, you feel very romantic, you have those natural feelings in you which help you to conceive, which help you to make good love. And when I ask her that, when you're making love, what are you thinking? She said, I'm thinking of work. So the question is that all of us, the working women especially, when we are so stressed out with our work and we have no time to make love, we have no time to conceive, we have no time to romanticize, how are we going to produce children? And what kind of children are coming? The amygdala of the mother is so big, the baby's amygdala is bigger. Let me tell you one thing, I have a 1.5-year-old grandchild at home. Now this little boy, when he sees food coming towards him, he runs away. So I was wondering, why he's running away. So I saw in the kitchen, my maid, what she was preparing was, supposing you're making khichdi. There should be rice, there should be dal, there should be vegetables and whatever. So what she was doing was, she was adding something else, paneer in that, and she was adding some dry fruit powder, or she was adding that oats powder. And when I was tasting it, it was not tasting good. So उसको इतना टेंशन बच्चे को उसको पसंद नहीं है वो खाना उसको जबरदस्ती दिया जा रहा है and I can't tell my daughter-in-law anything, okay? Because
Don't stress.
I don't want stress. I want to enjoy my life. What I do instead of that is that I take him very, very quietly to my room and I feed him my food. What I'm eating, he likes. He likes dry roti. Just cut the roti into small pieces, put it in front of him, and he very willingly eats it. He doesn't want spices, he doesn't know salt, he doesn't know anything. He doesn't know what is oats and all that. But one thing he knows is simple khana no he likes. And we are stressing our children. And that little boy, I want to really do his MRI and see how big is his amygdala. Thank you so much.
Practice has now come to this, where the patients come with a laundry list. They will tell you, I sleep more. But when you assess, they are sleeping normally. And by knowing all this, we have to educate them that this is normal sleep. Don't deprive yourself of sleep. So he says that, madam, 5 days a week I go to office and all. It's normal, there's a sleep debt. But Saturday, Sunday also they want to go for trekking. Saturday night they want to go for party. And Saturday whole day they want to clean the house. Night they want to go for party. Sunday they want to go for trek. It's not sustainable.
Yes.
They want the treatment to customize based
So
on
that treatment has to customize. Okay, so we have suicidal adolescents, and when we tell their parents that okay, we'll start the treatment, maybe we give a medication or a therapy, we schedule a therapy session, and the parent says no, this is not convenient. Child has an exam on Monday. This therapy timing is not convenient. Child is suicidal actively. Child has tried to kill themselves, but the parent is telling us that this is not convenient. Monday is the exam. We can't take him for therapy. So this is the significance of us knowing the rhythms, because we have the task of educating people. We've done with consumerism. We've done with responding to everything with a pill. You want to sleep less, take methylphenidate. You want to sleep more, take clonazepam. You want to eat less, take semaglutide. You want to eat more, take cyproheptadine. We got to stop this.
Incorporating relaxation time into our talking of lifestyle. So what we have seen is that diet and exercise everybody is following very ritually. They are meeting dietitians, they are following exercise. What people are not doing is relaxing. So what we have tried and told all our patients with all lifestyle disorders, whether it's diabetes, obesity, thyroid, that you need a separate half an hour of relaxation time. It may be your me time, it may be your thoughtless mind, it may be just lying on bed, just lying. Sir will tell you about certain simple exercises tomorrow and simple things to be done. And if you can't do anything, just lie down on bed and do nothing. So half an hour of this time is essential for everyone. For what reason? Because there is no cooling down. The body is heated, there is a sympathetic overactivity. Finally, as we heard, sir, autonomic health is what we want. Now, autonomic health means a balance of the parasympathetic and the sympathetic. Now, when you are in a continuous state of sympathetic drive, you see so many people dying in the gym. Yes. Why do you see so? I am sure they are not relaxing. I am sure they are overstretching their limits of their sympathetic nervous system. So why is this happening? Because there is no parasympathetic activity going on at all. And the need for us to, what the hype about being so active and proactive is so common that people fail to understand that relaxation is much more important than exercising.
Absolutely.
So
even
this is
yoga itself is taught as an exercise.
It's not a
Power
Not
yoga.
a relaxation.
Power yoga is so hot yoga and power yoga. The purpose of yoga, of course, I think we saw that there are many other purposes, many other meanings to yoga. But what I mean to say is that whenever you are counseling, you all are all wellness counselors, you all are educators in your own perspective. If you are counseling on relaxation, default. How to relax is individual perspective. It can be finding your flow, or it may be a meditation for somebody. For somebody, trekking may be a sort of relaxation. So going to nature may be relaxation. You can define the relaxation for them. So this has actually helped my practice. It has, in fact, it has surprised most of my patients that a lot of doctors tell us to exercise and you are telling me to relax. And that is the way that I think it's working very well. And the part of mind health also consists of having a thoughtless mind period. So as sir said, default state is always active and you're always consuming. So where does the tiredness come? The tiredness comes from that network utilization of the brain. So why do people feel fatigue without doing anything, without nice food, nice clothing, nice fitness, they go for exercise, but still fatigue is never gone because that's mental fatigue. And mental fatigue needs mental relaxation and zero mind. state.
Background apps are consuming the energy.
That's right. So default. So I think, sir, your
That is default state.
default state. That's right.
Default state.
Default.
Background apps consuming the energy.
That's right.
Draining
So
the battery.
now I hand over to I think we
Background
have
apps.
what is the
In
time?
connection with
Madam, अच्छा हो गया यार.
childhood
So-
amygdala.
So let me just say that today was very fascinating, and as you uttered this word, it should be titled, Amygdala Day. So, but the good news I tell you that there is a wonderful epidemiologic study available from the Netherlands, and it is called as the Rotterdam study. Rotterdam study has given us a good ray of hope that it is possible to keep amygdala under control.
Absolutely.
Okay, so that's why it is not, it's difficult but not impossible. Even if the amygdala are enlarged, but we can hopefully.
Even autism is increasing. Autism also autism is also one of these.
So therefore our great friend Nicholas Nassim Taleb says that that humanity का lifespan बढ़ गया है. That human beings are definitely enjoying now longevity. But those more years, unfortunately, are also more years spent in illness. So it is not that absolute good increment in the lifespan. So good quantity, but perhaps not good quality.
So you mentioned about childhood trauma.
Yes.
Just
What aspect you like to know? So it has two aspects. One is a trauma of threat, and the other one is trauma of deprivation. For example, from food deprivation to emotional deprivation. That also is a trauma, and the threat also is a different. They have to have slightly different biological configurations. And what happens that, precocious puberty, there is a precocious development of that amygdala, so it becomes oversized, and then it burns out after a while. So the people are no longer, once it burns out, they are no longer responsive to the environment in which they should be.
So I think we had a long day today. Thank you, sir, and
Very
I
long.
think it
Thank
was
you so much.
wonderful. I think the learning was well explained, and I'm sure we are a shade wiser and better. And today, the last session is going to be assessment of our physical health. So we have Namrata with us. Namrata is going to give us a questionnaire, and she's going to get us basic evaluation done in your own places so that we understand where we stand as physical health people. And then tomorrow onwards, she's going to make us do simple exercises at the end of the session. We start our day tomorrow at 7 in the morning. It's an optional thing. You are welcome to sleep because relaxation is equally needed. But if you want to join for the exercise, it's in the Jade Hall, 7 a.m. Jade Hall is just down, you carry on the walk and you'll see the Jade Hall over there. And after the assessment, she will tell us what she's going to plan for the tomorrow's session. So after tomorrow, the whole day is going to begin here at 10 o'clock, like today. So 10 o'clock to 1 o'clock, we will have Dr. Chadda sir, Manoj Chadda sir telling us on a different aspect of health, which we never talk of, that is economic health and economic wellness. So it is a change from mind and amygdala, so that we have some.
That is important for amygdala. Because if your economic health is good, economic security. See, economic security is also a very, very important kind of a part, and which must be addressed. Because we saw in the Maslow chart, that the security need, and one very important aspect of security need actually is a financial security. Okay.
So thereafter, Madam will give her perspective and her vision on what work she has been doing in yoga wellness since past 30 years. And thereafter in the afternoon, we will have Sir speaking on the sleep and important rhythms in life, followed by Dr. Vaijayanti speaking on immunity and related issues that she comes across in practice, and Namrata taking over to teach us ergonomics, right? So some new terms which I got from her is one was catharsis. So today's new learning was catharsis. Tomorrow I think ergonomics will be new for me. So lot of new things to come.
Physiotherapy की वो psychologist हो गई ना कि physiotherapist talking.
So over to you, Namrata.
Yeah. So Namrataला चांगलं आहे उद्या आणि tomorrow what I am going to basically give in very short is that in good old times, when the human beings were still normal human beings, so what was their sleep patterns? What was their sleep pattern? What was their digestive? I mean, what was considered as the normal human health? Okay, so that we have some benchmark in our mind. Like we said that
can carry on the
what
topic.
quantity of sleep, what quality of sleep, what kind of digestive quality, what kind of vital energy, what can be considered basically as normal. So give you a big feel there. So I'm good. So Vaishali madam, so they sit here, they continue to sit here and do this, or they go back to.
And thereafter we'll discuss for dinner.
Good. So I think my cab will be arriving now. Yeah, sure. Why not?
Hello. Just don't fill the form right now. I will be giving you instructions. So there is some intro before that, and then I will give you time to fill the form. Just do not fill it right now.
Anybody who is not what?
First forum where I am talking to so many people from the varied backgrounds. So again, thank you Dr. Vaishali Madam, Bhadbhade Sir and Madam, and Dr. Lagojoshi Madam for giving me this platform. So starting with the last session, that is something called as General Physical Activity Assessment. Next slide please. So as we are talking about wellness since morning, okay, so wellness has different dimensions to it, that is your physical, intellectual, emotional, then financial, as Dr. Chadda will be talking about it tomorrow, spiritual, environmental, and of course our work environment, okay. So all of that forms the wellness. So today, as a physical therapist, I am going to talk about much about the physical dimension of that wellness, okay. Next slide please. So this physical activity, what is the definition of physical activity? Can anybody tell me? What do you understand when I say physical activity? What is the physical activity?
Moving your body.
Moving your body, or yes, right? So any motion that we do or any movement of our body we do with the help of skeletal muscles, which requires the energy expenditure, or where the energy is, we are burning out our calories, is called as the physical activity. So there are two types of physical activity. One, that is a structured physical activity, that we go to gym and we perform set of exercises that are given by our trainer or physical therapist. We do that and we come home. So that is called as a structured physical activity. And the next one is incidental physical activity, that we do when we are dealing with our daily chores in the house, right? Or we are when we are going to our office, we are moving here and there. So that is also the incidental. So that is, or we are traveling from our home to office. How do we travel? By bike, by car, by bicycle nowadays. So that is all called as an incidental activity. Okay. So now, when we are moving forward, next slide please. So we will go to some of the epidemiology, okay. So now everyone is talking about that the incidence of diabetes is on rise. Along with that, something called as the metabolic disorder, which is a package of obesity, hypertension, then dyslipidemia, and some of the rheumatological disorders is on rise. And the major factor here, for the contributory factor, is the improper diet, that Geeta ma'am will be talking about tomorrow, and insufficient physical activity. So that are the major concerns, okay. So now, to deal with this, the WHO has come up with the WHO Foundation has come up with a new concept, that is a global to incorporate the activity globally. So they want to reduce the physical inactivity by 15% by 2030. So that is the goal that we want to achieve, or the WHO has given us globally. Okay, next please. So now when we are talking why we are doing this activity, because we are into wellness since long period, we are advising people that you need to be well, or you should be in the well physical, emotional, financial conditions, so that you will not have such of the non-communicable diseases. So I came across a really interesting study that the name of the study is Predictors of Physical Activity Promotion by Doctors. So what was their conclusion was very interesting, that it is not only the clinical setup, but as well as the medical doctors, their own physical activity, or their own, when they are involved in that physical activity, they tend to refer patients, or they tend to promote patients for further physical activity. So that is why today's assessment is all about that. As a doctors, or as working for the wellness of the community, we should be fit, or we should be attentive. So whatever you tell your patient, you should preach that. Okay, I'm talking about the fitness. I'm not talking about the measurements, the body mass measurements and anything. It is the physical activity which makes you feel healthier and happier. Okay, so next please. So when we are assessing physical activity, there is this questionnaire that has been given to you that is called as the Global Physical Activity Assessment. Okay, so there are 3 different domains where we assess the physical activity. That is your travel time, recreational time, okay, and that all physical activity has the unit that is called as metabolic equivalent. Okay, so that is the unit. So metabolic equivalent, so how much energy expenditure you do for those particular minutes. So that is called as met minutes. Okay. So 1 MET, that is metabolic equivalent, equals to 3.5 ml of oxygen consumption per minute. Okay. So when we are considering moderate intensity activity, it is 4 METs, and when we are involved in the vigorous activity, it is 8 METs. Okay, so now this part you should remember when you are filling your questionnaire. That is, if you are involved in moderate intensity activity, the unit is 4 METs, and vigorous physical activity is 8 METs. Okay, now there are various units for the intensities, like heart rate reserve hai, then there is something called as heart rate maximum. Then there is perceived exertion that we ask to our patients. So this is one of the unit that has been taken for the physical activity assessment. Okay, next please. So now, can you please show that Word document? Just minimize this and show that Word document. So now we will start filling the questionnaire. Okay. So each one of you will fill this. Okay. So this is the domains, that is what you do at your work, travel time and the recreational time. Okay. So now there are, in the activity work, you have 6 questions given. Okay. So you have to grade yourself whether you are involved in those particular activities, okay, or no. Huh? Now when they are saying that it is a moderate intensity of activity, you should have increase in heart rate and respiratory rate when you are doing that activity. So moderate intensity doesn't mean that from this chair I am going and sitting on that chair. Okay, so there has to be, for minimum of 10 minutes, increase in the heart rate and the respiratory rate. Okay, so that is called as the moderate intensity activity. And the vigorous intensity activity is you are running short of breath. Okay, so that much intense, and that is up to, you have to sustain that activity. If you are sustaining that activity for 10 minutes or more, then only it is called as vigorous or moderate intensity activity. So you have understood what is moderate. Moderate is you should have the perceived heart rate increase and the respiratory rate increase, and that should be maintained for at least 10 minutes or more, right? Or vigorous activity is you're running short of breath, and that has to be maintained for 10 minutes or more, right? So please grade accordingly, how many days you do, how many hours you do that activity, right? So please fill this domain for activity at work, right? And if you are not feeling any increase in the RR, HR, please skip that part. Yes? So if there is yes, start filling the next ones. If there is no, directly go to P4. That is, does your work involve moderate intensity. So the first 2-3 questions are for vigorous intensity. If your answer is no, straight go down to moderate ones. That is your 4, 5, 6. If that is also no, then skip that also and go to P7 directly. Okay, understood? Okay. Okay. So now going to the next domain, please scroll down. That is travel. Nowadays a lot of people using bicycle to move, right? So that time, how we are going from one place to another, right? So again, if you are having cycling or walking for 10 minutes continuously, please grade yourself. How many days do you do? Okay, and if there is no don't fill any of this, go to P10, right? And cycling and walking comes under the moderate intensity activity, so the consumption is 4 minutes, right? Then the recreational activities, again the same thing, that is the moderate intensity or the vigorous intensity. If you are involved in any sort of dancing, Zumba, okay, aerobics. So if you are doing that more than 10 minutes and there is increase in RR, HR, okay, so that is there. If you are not able to fill this, then directly go to the next section. That is called as sedentary sitting. Yes, moderate, but ma'am, you should have increase in RR, HR, which is perceived by you, and you have to do that moderate intensity activity for 10 minutes.
But
continuously.
intermittent activity cumulative.
Yes, but it has to be 10 minutes of bouts. Yes, in a bout. Yes, 10 minutes continuously एक bout होना चाहिए ma'am. If you have the intermittent moderate intensity or the vigorous intensity in bouts, but that bout has to be 10 minutes. The minimum is 10 minutes.
और उससे कम हुआ तो कोई activity
नहीं है तो नहीं आएगा.
5 मिनट के दो
नहीं आएगा. No.
फिर तो सारा दिन बैठे ही रहेंगे.
But do you feel that increase in the respiratory? Then you can write in the moderate intensity.
नहीं जैसे अब पार्किंग खूब दूर है और हॉस्पिटल का ये बहुत दूर है तो पैदल तो जाना ही पड़ता
हाँ लेकिन 10 minutes का है क्या मैम वो?
And are you working fast enough to feel
Yes,
the breathing? So that's good.
हाँ. So it has to be 10 minutes. Because to have those changes, you require that much minimum duration of 10 minutes of that particular activity. Then only you will feel that heart rate and RR.
If we do that activity for say about 4 hours, there will be only few 10-minute episodes. So
That is you can include.
So I should write 4 hours?
4 hours, yes. So the intermittent activity, minimum duration 10 minutes ka bouts, you can write that activity. Not a problem.
What is the difference between question 10 and 13?
Vigorous and moderate.
Vigorous and moderate. Vigorous is you are running short of breath. Yes. Breathless. And moderate intensity is you are perceiving your heart rate and respiratory rate is rising. Okay? And then the last part, scroll down please, is the sedentary work, sedentary sitting. For how much time you do and
9 to 10 hours.
okay. So now we will grade ourselves. Okay. Now we will grade ourselves, right? Please open your forms. Now we will grade ourselves. Okay. So we are going to the work area. Okay. So if you are fitting into that moderate intensity activity, okay. So please convert your hours into minutes. First do that. Convert your hours into minutes. Okay? Convert. We are at the first. So we are at the first part of this, right? Okay. So moderate intensity activity. If you are filled for moderate vigorous intensity activity, sorry, if you have filled 3 hours, okay, convert those 3 hours into minutes. Okay, converted. Now multiply those minutes by 4. Multiply that minutes by 4 because it is a vigorous intensity activity. So we are working at the activity at work. If you are working for 3 hours, convert that 3 hours into your minutes, right? Have you converted that into minutes? Huh? Yes. So if you are vigorous, no, into 4. If it is vigorous, please do that into 8. Yeah. Into 8. Okay? Vigorous into 8. So minutes into 8. Okay? Yes. And if you have written 3 days per week vigorous activity, so you have minutes, you have multiplied by that 8 into whatever days. Yes. Okay? So that is the formula. Right? So minutes into METs, that is 8 for vigorous, and number of days that you are doing that activity. So that is for vigorous. Now going for the moderate one. Yes. So for moderate one, convert those hours into minutes. Okay, into 4 into number of days. So that is for all now. Okay. So now the travel time. Going to the next component, that is travel time. Travel time is via bicycle or you're walking, but that has to be for minimum 10 minutes, and that is considered as moderate intensity activity. So convert the hours into minutes into 4 into number of days. Okay? Zalo? Done? Okay. Now again for the recreational, we are at the vigorous mode. So vigorous again, number of days into minutes into 8. Okay, minutes into MET value into your days, right? And now we are going to recreational of moderate. So minutes into 4 into number of days. Okay. Vigorous is 8. Multiply by 8. And it is, ma'am, if you have to convert the hours into minutes. So if you are quantifying your moderate, then multiply that number with 4 and by your 8. If it is number of days, whatever number of days. Okay. So it is minutes into METs and then number of days. Okay. So for moderate it is 4 and for vigorous it is 8. Done? Everyone? Right? Now you have to do summation of all these. The 9. So you have to do summation of all of these. No, for sedentary nothing.
Resting metabolic rate भी नहीं?
नहीं, कुछ नहीं. Okay? So all the domains. So the recreational, travel time and your work time. Now please all sum it up. Okay? So you have minutes into whatever METs, that is 8 or 4 into number of days for your activity at work. Then you have for the travel, then you have for the recreation. Now all 3 of that you sum it up. Okay? Yes. So moderate is 4 and vigorous is 8. So minutes into whatever MET values and into number of days. Right? And sum it up. All 3 components together. That is work activity, then travel time and then your recreational activity. Everyone has done that? Okay. So now we will see how it goes. PPT please. Okay. So if your MET minutes per week are less than 600, you are inactive person. Totally inactive, sedentary person. If you are slightly active, then the met minutes should be 600 to 3999. Okay, 4000 to 799 is moderately active, and more than 8000 is called as highly active. Okay, so please grade yourself in these where you stand. Okay, and if we want to promote physical activity in our patients, we should start doing the physical activity up to the mark. Then only we should be able to promote it better.
But suppose
Moderate intensity, that is 4000 to 7999. Yes.
but
So the
suppose
ideal.
if somebody is doing yoga,
Yes.
not the intensity of exercise. One more question.
So we should, yes.
These are the WHO's recommendations.
Yes,
There are
these
some
are.
recommendations from ACSMs also.
Yes.
So
So the WHO and ACSM are comparable, ma'am. So you can follow. So there is something on the similar parallel lines.
They are different actually.
Yeah, they are different, but the
See the minutes moderate intensity in a week, and if you are doing a high intensity thing, then 75 minutes.
yes,
And,
that
and,
is
and
there.
there is a age cutoff for that.
These guidelines are also there. So that I'll be covering tomorrow. Yes. So this is for adult, not for children, not for elderly. Adult. Okay. Next slide, please. And if you want to excel in that, you can reach up to 300 minutes per week also in the bouts. Yes, that is 5 hours.
You take all of us as inactive. And
Yes.
you tell us that what is the base recommendation. That is
Yes,
what
sure.
because all of us are definitely inactive.
Yes. Okay, so this is about our own assessment of physical activity. And now, next slide please. And along with that, because the aerobic doesn't work alone, we have to go with the muscle strengthening exercises. I'm not talking about the lifting weights like the power lifters, but you can use your own body weight as a resistance and work with that. Okay, so maybe yes, pushes or climbing the stairs up and down is also one of the exercise. So all these muscle strengthening exercises has to be done 2 days at least in a week. Okay, and I want to talk about one myth that the strengthening exercises should not be given to children. Okay, but nowadays there are a lot of recent advances which are coming up that we can start strengthening by 5 years of age. You can start actual weightlifting by 5 years of age. So there is no such you should not have any inhibitions giving weight training to your children also, right? Next slide please. So now, coming up with the next test that we are sitting all the day, so now we will do some activity, right? Everyone has the chair, right? And now what we have to do is sit and stand test, okay? So what you have to do is the lady who's sitting there and standing up. So you don't have to use the support of the armrest. And wait, I will give you instructions. Which assesses your endurance as well as the strength, basically your quadriceps, which is the main important muscle, right? Okay. So there are variations of it. 1 minute we can do, 30 seconds we can do 5 repetitions. Okay. So we are going to do 1 minute. Can you please? 2, 3, go. Keep a count of your sit and stands. Okay. If you feel tired, you can stop doing it.
Stop?
No. 1 minute. If you are tired, I said. And you have to sit properly on the seat and then come up. Huh?
I can bet with any young man in the room.
हो गया 1 minute.
नहीं हो गया. 15 seconds to go. Don't stop, keep on going like the plank. Stop.
Good.
Nice. Okay. So now we will take a count how much it is. So for you,
Maybe 50. I can challenge any youngest man in this room tomorrow. We can have a match.
Okay, so sir had 50, 42, 42, 38, 38, 38, 38, 35, 39, 30, 30, 30, 30, 37, 37, 38, 28, 28, 42, 42,
37. 37.
okay, 32, 32, 40, 40, 34,
30, 38,
37,
44.
41,
41,
okay,
43,
okay,
41,
41, okay,
28,
okay,
26,
okay,
30.
okay,
35.
okay, 28, 28, okay. So now I'll tell you the normative norms. So if you are above, how many of you are above 60? Yes. Okay. So for a minute you should be doing 24 to 30. Yes. Yes. Then no, above 60 is above 60 and age dependent. Okay, how many above 60? Above 60. Yes, age wise. Now, how many of you are between 30 to 50s?
Or 50 to 60.
30 to 60. Huh? 30 to 60. 30 to 60. 30 to 60. Its minimum required is 50. 50.
Yes. 50 to 60 के लिए अलग नहीं?
हाँ?
50 to 60 के लिए कुछ अलग
नहीं. It is plus or minus 12. Plus or minus 12. So the standard deviation is plus or minus 12. Yes, because that is the age range that is given, and that too, 1 minute. Just this sit to stand test. We have these are done based on China studies, okay? So the Indian, yes, so the Indian normative values are so still the research is on that how many are the what is the normative value for that, but this is based on because we belong to the Asia Khanda, so that is so I have taken that as a normative value.
I have a doubt. How about form? Because you can just do fast or it's really,
So that is up to you. We are not supposed to give any instructions how you are doing it. Okay, so it is just that you cannot use any support. You have to maintain the shoulder width distance between your feet, and you have to get up and go down. So that is according to your own pace. So that you have to do. It is not that you have to do it briskly or very slowly. Those instructions are not given. Okay. Fine. So this is about sit to stand. And next that we were talking about proprioception, so I will take that exercise also. Now just stand everyone. Look straight, right? And now what you have to do is you have to maintain this position for 1 entire minute. Okay? And just see how you are swaying forward, backward. Yes, feet together. Touching each other. Yes, touching each other. And look forward, okay? Straight. What? Eyes open, eyes open, eyes open. Right? Just pay attention to your sways, okay? How you are moving forward, backward, right, left. The stance, okay? Now just close your eyes and maintain the stance. And just appreciate the difference. In this way, okay? Because the vision was overpowering our proprioceptive proprioceptors, and we are not trained that way. So the proprioceptors are the more sensitive to catch the tension which is generated in the muscle, and by that they send the sensory input to our brain continuously that this muscle is acting at one tension. So they work more as a calibrators in our body, so that the person can know how much tension to generate in the we call it as yes, well, yes. And the recurrence of the ankle instability or the ligamentous instability also goes down with
Injuries
that.
will be reduced.
Yes, injury rate will be reduced. Yes.
Yeah, I have a question about vestibular system. Like,
Yes.
What I have learned that in people, older people, if they are not able to balance in the yoga poses, we generally give that vestibular activity, like, walk in the same line, those kind of activities that I generally ask them to do. So, can you just explain little more the difference in vestibular and this proprioceptor?
So now, ma'am, when we are talking about the vestibular system, we do give these working schedules that walk in a one line. Yes, but we don't occlude the vision, or we don't move the neck. Okay, so when we want to challenge the vestibular system also, that it should not work or it should get engaged in something else, we ask them to do the same activities with the movements of the neck and the trunk. So that is also taken care of. So the now athlete completely depends on the proprioceptors which are working at the joint level. So that is how we negate all the visual, auditory and our vestibular system. There is something also called as dual tasking that we do. So the people are typing on a mobile and performing a task. Okay, so that is also, we train the athlete like that. So with that also, we are also training the dual tasking to the brain by working on the vestibular, visual as well as the proprioceptors, balancing everything together and performing. So the dual tasking and all this works to improve the performance of the athlete.
Okay, so I just have another question.
Yes.
It's not related. That is there any way, like, we can improve the life of elderly people using these techniques?
Yes, surely. So there are something called as joint compression techniques that I will take tomorrow.
Okay.
Where you can give them simple exercises to them. With that, you can improve the joint position.
Because balancing is
Yes.
the biggest issue I have seen in
Yes.
elderly people.
Yes. Yes.
And
even in the diabetes people also, because of the peripheral neuropathy setting in, a lot of proprioceptive losses that happens. So
okay.
we
So you will be
them.
teaching some
Yes.
few
Yes.
techniques
Yes.
tomorrow.
Simple techniques.
Okay, thank you so
Lot
much.
of elderly also start having lot of autonomic dysfunction. Actually, that is also one of the biggest cause of the
Yes.
falls
Yes.
in Parkinson's and in even elderly, normal elderly. It's lot of
Falls are usually multifactorial.
multifactorial.
In India. And even without any neuropathy, if we check vibration sense regularly,
Yes.
in elderly it is usually
Correct.
reduced in
Yes,
the
absolutely.
Thank you.
Thank you, Namrata. Yes. I do have two questions. First of all, the recommendations for physical activity, they are based on Caucasian people's data. So, shouldn't we have something which will be applicable and which will include the genetical variation as well as biorhythms according to season?
Of course.
So, amount of
Yes.
activity we should do
Yes.
is
Yes.
should be different for
Yes.
every person and
Yes.
every season.
Correct. You're
So, instead
absolutely.
of going with like
Yes, that is what. So that is what, there is one study, like I said, that you don't have to stick to these norms. These norms are ideal ones and which are mainly based on the American population, European population. So there are no norms for the Indian population. Okay. So, but we have to start somewhere. So these are the guidelines where we can look up to. Okay, but these are not the only guidelines that we should follow. So once we get the data from the India but unfortunately there are no such researches based on Indian population that what are the normative values for the Indian population to perform. Because as you see that the lot of questionnaires which assess the physical activity, they are also from the Western countries. Okay, so we have a lot of rural population coming up, that is the farmers and everything. They don't consider them. Okay, so we have to have those questionnaires like that developed for Indian population or the Asian population. So that is the drawback of all these assessments. Yes, that is there.
Yeah, but at least we can go from less than 600 to 600 and above.
Yes.
600.
Yes.
The second question is going to be like something
Wait for that.
we love jugaad, as explained.
Yes.
So is there any way, because there was this diagram about brain, you told that you can train
Yes.
depending on activity. So we know that it's not calorie in, calorie out, right?
Yes.
And if you can train athletes with using specific kind of activity,
Yes.
how about, are there any kind of yoga mudra or something where we can increase our metabolism? Minimum efforts, maximum benefits. Is that possible?
There is something called as you can maintain that. I am not a person who should talk about yoga because I did not have a lot of exposure of yoga. But yes, I can tell you that when we work with the ergonomics, okay, and when we are training people, we work maintaining of that static position for a prolonged period of time. Okay, so normally in physical therapy, what we do is suppose a person आ रहा है तो उनको बोलते हैं 10 repetitions 10 times. 1, 2, 3, 4, 5, 6 and maintain that for 10 seconds. But nowadays we have come to the conclusion that that doesn't work. To formulate something called as engram. Okay, so to have that movement, you should create that environment that the movement has to be performed for a prolonged period of time for maximum number of times. Then only that one engram is created, that is the new connection is created, that this movement is happening over the period of time for longer duration. Then only my brain understands, okay, this is happening, and now my brain understands that this is the movement that I should learn, and that is how the engram is created, and that is how the movement is relearned. Okay, so we work more with the static postures, the exercise postures. Okay, I am not talking about the static sitting posture. Okay, so the exercise posture for a long period of time. The same goes for stretching also. If many of the athletes and many of the normal population also, they stretch for 30 seconds, 10 seconds. 30 seconds, 10 seconds में मैम कुछ नहीं होता है. It is not even your muscle and the length, that is just taking up the slack. Okay, so if you are maintaining that particular stretch for a prolonged period of time, let's say 1 or 2 minutes, and you're performing that stretches for 4 or 5 times a day, then only you get that flexibility. Okay, so all the flexible people or those who are practicing yoga, okay, they get these flexibility because they are trying these postures for a prolonged period of time and they maintain that position for a prolonged period of time. So there is something called as, when we are talking about the collagenous tissue, okay, there is something called as that taking up the slack, that the tissue from the resting position we are tightening up, okay, and then it goes into the elastic range. So if we are not going into the elastic range, by the 10 seconds the elastic range is not reached only. So to go into the elastic range, you need to give that time to that particular tissue, then only that tissue is lengthened. And then only you will get that effect. Otherwise you will not get it. So that is how we work.
I think that's because we will be so interested. We are sitting down and still, enjoying the benefits of doing workout.
There was that one one message on WhatsApp was going viral that you put something on your calf muscles like a. No, just I thought of that.
Even the spot reduction. Okay, so many of the gyms they have this spot reductions for the abdomen. We will give spot reductions in 15 days. That doesn't work. When you're working out, your entire all the systems work together.
Yeah.
So there is nothing called as one body part is working and the other working. So that is all fake. You cannot have such.
There is one more concept. There is one more concept. I think that is very important in terms of energy expenditure and all. It's a low throughput system and a high throughput system. That more calorie intake, more burning out. Less calorie intake, less burning out. So there are two ways I think in which.
See, there is one actually. She asked a good inclined question, like she has been asking a lot of them today, which is a good thing. See, there is a slight confusion here, in the frame, in the sense that there is some physical activity requirement which is supposed to reduce mortality. That is completely different, than actually the parameters for fitness. The two are different things.
Yes.
One is to prevent premature mortality, premature morbidity and mortality. And how are those figures derived? They are mostly derived retrospectively from actually the mortality charts of people. That who was active for how many minutes and what is the risk, that supposing those people who are physically active, say 50 minutes a week, what was the risk of premature dying in them? Those who were active 100 minutes, what was the risk like that? That is how actually that is derived. It is not based upon population norms. Let us understand this very clearly. That the idea of being physically active to reduce the premature death, because death is considered as the real hard endpoint, and then also maybe onset of some of the NCDs, etc. So that is mostly retrospective, and it has no norms. It just has a cutoff. That if you don't want to die prematurely, or you don't want to have premature development of certain diseases, then this is how you should be. A very famous study called as a cardia study. Maybe during the course of that we'll discuss about it sometime, that if you invest in your health during your young age, what benefit does it have, later on, etc. So these are normally, very long-term data, and they are derived. This is completely in contrast to, like what she was saying, whether the American College of Sports Medicine or any other fitness norms. That is a completely different thing, which age-wise puts people, So the two are therefore different, They are not the same concept. One is based upon that you gather a crowd of 1,000 people and you see, that how many belong to which part of the curve that you get, so it's a different activity compared to the mortality. So we have to be very clear, And there are then more ideas also, Some people also propose an idea called as a fit for the purpose. For example, a person who is in a blue collar job is expected to have completely different level of fitness, to be able to perform that task, versus a person who is a white collar job. Again, there is a difference between that. Then Lina said, now the more interesting new coming idea is a higher throughput versus low throughput. Once upon a time, when we started in science, the whole idea was about calories, burning calories. Burning calories is out now. Burning calorie was too simplistic understanding of the whole NCD. She will describe you in detail, kind of a later, that this burning calorie is not something, which holds kind of. On the contrary, the more you try to burn calorie, more is the sympathetic activation, more is the cortisol, and more you increase actually the NCD. So, म्हणून मी सकाळी जे म्हणालो ना की दिसतं तसं नसतं. The biggest thing, I think the paradox in NCD is, as she rightly said, people need more relaxation than actually the sympathetic activation. Like what she said here, that you should do an activity which increases your heart rate. How does heart rate increase? Heart rate increases by increasing the sympathetic system. So, taking a case by case call on that, rather than general rules. Low throughput system means that you actually try to reduce, the incidence of sympathetic overdrive, so that you are helping reduce actually the overall NCD. So it actually is a sort of something which is entirely dependent on the what you can call as an autonomic phenotype. We are going to discuss that what kind of state your autonomic nervous system is in. Is your autonomic nervous system deficient in parasympathetic? Is your nervous system overactive in sympathetic? Is your nervous system sort of giving way, autonomic nervous system, that it is no longer able to even support your basic functioning? So you have to assess that, and depending on that situation, then you have to come to a certain conclusion. So where actually that's why it's a clinical art. You cannot have
and
these
it's
sort of
what sir is saying.
So
if you have a patient who is already having sympathetic hyperactivity, you imagine that he tries to go to 6,000. You are going to get him into a state of exhaustion. So you need to understand what Namrata said in light of fitness. So we need to have, suppose the major problem with exercise today is that hardly people are assessed for their autonomic nervous system before going for exercise. And very simple example, I recently had my own done, and my parasympathetic is absolutely low and sympathetic is very high. But anybody who would see me would tell me, why don't you run every day? But there is a contrary to this, that there are systems, there are people to tell me that you should build up your parasympathetic rather than work on your sympathetic. So I think looks are deceptive. What is not deceptive is autonomic nervous system. So it gives you your inner feel of the body. So if your inner feel of the body shows that there is an imbalance between sympathetic and parasympathetic, you need to identify. A person who has parasympathetic less, you will work on exercises which increase that. A person who has sympathetic excess, you will try to reduce that, and you will try to seek a balance. So that purpose of exercise can't be a protocolized exercise. So though guidelines are useful for masses, For individualization, it is a need to identify which patient requires which type of exercise.
That is the personalization of medicine.
This is
required.
individualization
आणि
of
म्हणून पुढे
exercise.
थोडंसं त्याचं वजन जास्त दिसलं म्हणजे त्याला लगेच नाही का लाव रे व्यायामाला घालव रे कॅलोरी कमी खायला ते doesn't work that way worsen that person's obesity. You have to be aware of that, you know. That's why नाही का diabetes worsen होऊ शकतो, obesity worsen होऊ शकते.
So we see that people tell us that I started exercise and my sugar shot up. Lot of people tell us that my BP shot up after I started exercising.
Or they are cutting calories and they start getting panic attacks.
Yes.
So that's what that is what we have to work with them incrementally. It is not that the person is coming and we are putting him to this job. Okay, that now you have to do 10 repetitions of this, 10 repetitions of this. That will not work that way. So that is why you will understand that the people will get more aches and pains when they go to the gym without any prescription. Okay, and the trainer is pushing them that you have to do these many push-ups.
No, this dimensional model of health is very important.
Yes.
No, because the athletes are in a completely different
So
zone
it
on that
has to
health
be
dimension.
it has to be
Versus the other,
individualized.
where are they? You know, where are they on that health dimension? You know, it depends that what is.
So it is
really suitable.
individualized approach, and based on that, one more thing is that it should be enjoyed by that one person. Okay, so whatever you enjoy, you have to do that physical activity. It is not that I recommend this sort of form, you should do this sort of form. Whatever you enjoy, you try to maintain that physical activity within your own comforts. Okay, so whenever we tell our patients also that you have to be precautious when you are doing the exercises, your form is very important thing, that how you should perform that particular exercise. And if you are feeling that anywhere there is ache and pain, you should stop that particular exercise then and there itself. So these are the two important things that we always tell our patients that they should be doing. Okay? Yes.
So I think lot of insights today from you had something to say.
I just had a question. Actually, I have read somewhere about the soleus push-up. Soleus push-up, they do some sort of exercise where they activate the calf muscle just by sitting and shaking the legs. And they said that the calf muscles are the major consumer for the glucose.
Because it is called as peripheral heart. Because it gives the venous return back to our heart. So that is why they work like that. But yes, you do.
So what is your recommendation on that?
It is working just on a calf doesn't work. You have to, that is what I am saying. There is nothing called as the spot activity. It is the entire body should move as a whole. Because from our head till the nail of our toe, everything is connected together. Okay? From the fascia to the nervous system, skin, muscles, bones, everything works together. So that is why it is the mind and body. So first body has to be together, then you can be connected to your mind and then you work together. So there is nothing called as the
But there
spot
are
activation.
elder people, diabetic, who can't do such kind of activity like going out or any kind of the physical activity. So is it recommendable?
So we have different types of modes for them. Okay, so if a person with the diabetes who is having problems with walking, we can give them cycling. If they have also pain somewhere in the lower limbs, we have something called as arm ergometer that we can give them. Okay, or if that is also not possible, the new coming up way is the hydrotherapy. We put the person into the water because now the water takes the entire load of the body, no compressive loads coming on the joints, and the person work in the water. And we have got fantastic results with the osteoarthritis and the rheumatoid arthritis affecting the hip, knee, and ankle. So that is, so there are different modes and there are different individualization depending on how many systems are affected in that person. So if I am treating an osteoarthritis patient alone versus I am treating osteoarthritis with obesity versus osteoarthritis, obesity, diabetes and hypertension, my approach will be different for all because I need to take into consideration the other comorbidities also. Yes, so for diabetic people, I need to understand when he is taking insulin, how I should formulate my regimen after how many hours after taking insulin. So all that matters.
Yeah, Namrata, I have a question for you. How long they can go?
So this okay. So I will quote my sir, Dr. Sharapani. Whenever some patient used to ask him this question that how should I know where I should stop?
Correct.
So it is the moment you feel uncomfortable
While doing
that is to start with.
Yes.
But if you go on doing it
Yes.
many months, that stage will cross over.
Yes.
So how should I know what is my maximum capacity at the
Yes.
end?
If you are doing that exercise for a prolonged period of time, that is called something, the state comes that is called as adaptability. So that weight becomes easy to lift.
Right.
Or that particular exercise you are performing in lesser period of time. Then that is the time you understand, okay, I need to progress. But when I am progressing, I should not land up with something called as delayed onset muscle soreness. Okay, so if I am doing 30 sit-ups, okay, and now 30 sit-ups for me are easy. So now I will progress with 3-5.
So in your experience,
Yes.
how much time period is required?
8 weeks. 8 weeks. 8 weeks.
8 weeks.
2
After
months.
8 weeks, they know?
Yes, the muscle changes.
I'll just
and
add to this point that the question that you are asking, if I have to answer in a
How should I
metabolic,
know my maximum capacity?
if I have to answer in a metabolic term, we see that we take cardiac fitness before exercise. What do they do in cardiac fitness? They do a ECG, stress test, and if required, a angiogram or a 2D echo. How many of us really do the neurological assessment of the heart? We really don't do. And the major catastrophes with exercise have been neurological, arrhythmias. So the main concern here is, whatever she says, if the person is having a heart rate variability or an imbalance, he may take 8 months also to get into that phase of comfort. And similarly, there may be a person like her who is already training herself who will take only 8 days. So it will go with individualization of your cardiac capacity, of the cardiac nerves, the cardiac blood vessels, and the cardiac overall structure.
Exactly this I wanted to ask, because my problem is I am a regular hiker. I am regular into exercise. But I know one limit. Once I cross that limit, if I am a little brisker or if I cross that limit, I develop migraine.
Okay.
So I am not going to cross and I am not able to cross that limit. So do you have any advices?
Madam, should I say something about it?
Yes, ma'am.
Because in sports medicine itself, now to assess the performance of the athletes, the heart rate variability is used. If you are working in an overweight, your heart rate variability is going to reduce.
Yes.
So when there is a reduction in variability, that is the stopping point for the training of that person. Because that's why what we are saying is that you assess the initial level of heart rate variability before starting any program. Because if your heart rate variability is improving, that means that your capacity is okay. When it starts going down, that means you are doing more. So this is what now the letters they are using for the training of sports person themselves. It's called as overtraining syndrome.
Yes.
Overtraining.
Yes. What is described is in the heart rate. It may
Heart rate
affect the
variability. Yes.
Even the blood pressure also goes
Yes.
similarly,
Yes.
but we don't take the blood pressure.
Correct.
Right?
So
So
we
heart rate variability is probably
Yes.
a parameter.
Or even when we take the rate of perceived exertion.
Yeah. RP is also.
Yes, RP is also
Target
there.
heart rate we used to take before.
But target heart rate, ma'am, you cannot assess it. The patient cannot assess it, but he can tell us the RP. That is rate of perceived exertion on that scale.
So I think this
And then-
discussion will go on and on till tomorrow, day after also.
Yes. It's
So
nice.
Namrata, there will be a lot of questions.
Yeah.
Good.
I think one thing I've taken from her today's talk is that in between my OPD patients, I'm going to do the sit and stand. I'm going to do that. I'm going to lock the door and I'm going to do it every day.
So one senior psychiatrist told me when I was going to start my practice that when patients finish their consultation and they are really not going,
You